The Laikipia University Health Week 2018 kicked off with a seminar on non-communicable diseases, alcohol, drug and substance abuse. Both students and stakeholders were in attendance. The day one set aside for seminars was graced by Professor Joseph Rotich, the Laikipia University Vice Chancellor.
Ladies and gentlemen, this is a very important week for us. And it's important in the sense that I was particularly impressed that this time the medical people here decided to talk about non-communicable diseases. Most of the time, we have been dealing with communicable diseases. Forget about malaria, forget about typhoid, forget about all those communicable diseases. But these ones, ladies and gentlemen, as young as you are, please take care of these non-communicable diseases.
Had the opportunity to interact with the likes of NACADA, that is the National Agency for the Campaign Against Drug Abuse, NHIF, AMPAD, among other organizations in a question and answer session. The topic on non-communicable diseases, which is this year's theme, was expounded with facts stated and rumors set aside.
Herbal products cure cancer. The population will go to the herbal doctors and they come to us very late.
Among the speakers, one was unanimously labeled a warrior after her life experience with not only cancer but HIV and AIDS.
In 1999, I was diagnosed with HIV, and I was told I had cervical cancer stage 2.
Presentations on various non-communicable diseases were made with the sole aim of creating awareness. These included diabetes mellitus, hypertension, obesity, and cancer. Those in attendance were entertained by very own Laikipia University students. Second day marked the official opening of the Health Week with Kisumu First Lady Mrs. Dorothy Nyong'o, who is the co-founder African Cancer Foundation, as a guest of honor. Both students and local residents came out in large numbers to get their health checked. All tests carried out were absolutely free of charge, thus motivated the large turnout. They were entertained as they had their health checked. The Vice Chancellor and Mrs. Dorothy Nyong'o too were not left behind as they danced to the music. Each speaker emphasized on the need to get screened for cancer every once in a while in order to beat the disease.
Early detection saves lives, so that at least it was not happening the year before. It's only been happening in the past 12 months, and that should be early enough to address it. And so we want to encourage that practice and habit for people to go for regular checkups. So once again, I just want to reiterate to Laikipia University that you've done a great thing, and please do not drop this tradition.
Dorothy Nyong'o, we feel appreciated that you are able to come and take us through and educate our people, especially in related to these non-communicable diseases, particularly the cancers. Now, here, Your Excellency, you can see several tents. We have several partners here who have come to help us make sure that this week succeeds. So we shall be seeing what they are doing. We shall see how they are doing it. And from the look of things, I'm already seeing queues forming.
Had a few things to say about Laikipia University, a message to those who turned out positive for cancer cells, and also answered a few questions regarding cancer treatment in abroad.
The university is great. They've been having this
Health Week for several years now. We've partnered with them for 4 years. And this is such a great initiative because you get to educate people on cancer and other diseases, and also you get to introduce people to regular screening, which is really great. So it's for the students as well as the general public, and I think that's an amazing job that Laikipia University is doing. When we do the screening, as we are doing here, if we find somebody is positive, it does not mean that we are sure that they have cancer. What we do is we refer them to a hospital so that they can have a proper diagnosis, including a biopsy. In this case, at Laikipia University, we are very fortunate to have AMPATH on board, which is at Moi Teaching and Referral Hospital, and they are doing the biopsies right here. So that's really a plus. So we normally refer people for biopsies, and that is what will determine whether the person has the cancer and what stage the cancer is at. And then they can begin their cancer journey to get the right treatment. Africa Cancer Foundation is a member of the Kenyan Network of Cancer Organizations, and I'm a board member, not a managing director, but a board member of Kenyan Network of Cancer Organizations. And one of the things that we do is lobbying with policymakers and the government to make treatment more affordable and more available. And already I think you're beginning to hear certain bills and certain actions are being taken by the government to spread the cancer services throughout the country, which is a good thing. It's not happening fast enough because although some equipment has been sent to the counties, we don't have enough personnel trained to man the equipment, and so we just like to see more of that. Let the training happen so that personnel becomes available, and so that the services are more available throughout the country. Not too clear what's going wrong, but one thing for certain is that cancer treatment is a journey. So even if you go to India for treatment, maybe surgery, maybe radiation, maybe start of chemotherapy, one needs to know that it takes a long time to deal with cancer. So after surgery, you might need radiation and you might need chemo. The likelihood is that you're not going to be in India the whole time. So one tends to come back. So the question is, what is the follow-up care? And if your doctors and caregivers are not in contact with the people who treated you, sometimes something goes wrong in terms of managing the follow-up. And
Throughout the day, guests were entertained by the Stompers dance crew with their incredible moves. All in all, the day was considered a success by those in attendance.
Students are really raring to go about this outcome, and I can see they're helping in any way they can, and that's a good thing. Yeah, so I hope locals will turn up as well.
Yeah, we hope so too.
Yeah.
Like we have high expectations about that.
Yes.
So do tell us your expectation.
My expectation is more students are going to be coming. I'm going to be showing up, as well as locals and people around the area. And this is about almost everything: cancer, heart disease, blood pressure, and every kind of thing.
Health comes first in all occasions, and for a nation to develop, also the people should be established health-wise. Laikipia University, as it celebrates its corporate social responsibility, it prepared a health week beginning on Monday 15th till today Thursday 18th. The health week, always organized at the beginning of the first semester of every academic year, attracted large numbers from within the institution and surrounding environs. Many tests were done for free, and this is meant to help all from these environs to live a better life. In the process, men that were found to be suffering from various conditions, they would be advised on what to do and receive the right medication. Although to some it is a tendency to wait till they fall sick then to seek medical attention, medical practitioners advise all to ensure they undergo various checkups to ensure they are well for a healthy living. Kicking off, the exercise left many of the university administrators going through the checkup at the various units like body mass, blood sugar, blood pressure, eye checkup, VCT, breast cancer, and so many other checkups. The Vice Chancellor, like Kipe University, Professor Rotich, is one of those who chose healthy living by undergoing through this vital checkup.
I've gone through the system. I've actually donated my blood the other day, the first day. I've also checked my weight. I've also checked my BMI. I'm now going to have a breast cancer screening in just a few seconds from here. But I'm also planning to join the queue for VCT.
Lecturers too were not left behind during this exercise. They came out in large numbers to confirm their health status.
I've gone through all the stages, and I believe I'm a role model even to my students when I undertake, including also some colleagues. It is good to go through the whole process, and I feel now better. I have more confidence. If I compare to the way I was when I came early in the morning, I'm much better now.
Taking advantage of this, students too stormed various stands around to know their health condition and plan well for their future.
Naitwa Esther Muli. I take USAL, BSc USAL. Nime manage kupitia all the stations isipokuwa moja. Many people are having problems like cancer develops without us knowing. So, with this free initiative by the school, we think it is wise to come and participate and know our state, because it is like a gift to us to identify those diseases that we cannot just know out of the blues. It doesn't come like malaria. At some point, at the starting point, you're very anxious. You want to know, for example, your state, if it is the HIV section. You want to also donate blood. You're also thinking of what are the results? What is my weight? What is my height? You also, if you find your pressure is low, you are thinking to yourself, what aren't I doing or what am I to do? You're anxious. The entire process for me was quite engaging. Services themselves from the doctors are quite okay.
Apart from healthy checkup, there was blood donation to save a life.
I want to be part of the team that helps the people who are in need of blood, because maybe there's someone out there in the hospital who would benefit from the blood that I'm donating. So it's the heart to help someone out there who could be wanting the blood that I'm donating. Apart from the injection, it's a good process. The fact that you feel that you have helped someone, it's not tedious. Actually, it does not take long. Within no time, you're done. And it's a good process, and I'm enjoying every bit of it.
What a great pressure to see hundreds come out to save someone. By the closure of the health week, more than 106 liters of blood had been donated, and more than 1,156 people had undergone a health checkup. During this event, it was realized that some were caught by surprise that they were sick or suffering from some conditions like cancer without their knowledge.
For example, I was a bit apprehensive because earlier my blood pressure was a bit wanting. But after taking some rounds, I've come again for another test and it's been found to be somewhat normal.
The question many ask is, are there benefits of one going out for a health checkup before one is sick?
Health checkups are usually very, very important because they assist whoever is being checked to give him or her time to get to get prevention. We hardly go for checkups. But if we go for checkups, it is very easy for you to maintain your health and also to ensure that whatever condition you have,
it can be managed before it becomes very, very critical.
For it, one should not take for granted going out for a health check. It can save one's life.
You cannot joke around with your health. A checkup is very different from when you're curing the disease. When you're checked and you know your status, your state, it is very okay for you because you won't incur any cost in treating yourself. And you will also know how to maintain your body and to eat the right way.
Meeting out the expectations, Dr. Mlongo, the Chief Medical Officer Laikipia University, unveils this awesome achievement.
To us it is a success because there are those who came wanting to know their state as concerns non-communicable diseases, and that did happen. We are pleased that this year we were able to do more than we were able to do the previous years of screenings. We were able to do biopsies where we are getting the samples, analyzing them, and we are also able this time around to follow up our patients, not just randomly, but targeted follow-up of any patients that we have seen this time.
The Health Week was a great success to the university and the medical staff in general.